Have that right. It's 40 minutes now past 10 a.m. on your morning rush here on the Beast 97.9 FM. And I did say that I was going to bring a special guest for you again today, just like I did yesterday. And in the studio with me today, I have the honor, the privilege of having the Director General of the National Center of Disease Control, the NCDC, here with me in the studio, Dr. Jide Idris. Good morning, sir.
Good morning to you.
Good morning. So good to have you in the studio with me. How are you doing, sir?
We're doing good. And you?
I'm fine. I'm fine. you seem like one of us. Like you're still very young and vibrant. So I love to see it.
Age is a matter of the heart.
I know. Okay, so we just want to. I wouldn't take too much of your time, so we can move on to talking about Mpox and how it's become, such a topic of conversation, and with some people not having adequate information on what it is. And I'm glad about this public service announcement I just played, which kind of gives a breakdown into what Mpox is and how it can be spread from person to person. But we're dealing with a lot of young people who think it could also be like maybe a sexually transmitted disease. Can I get it through sex? So yeah, there's so many controversies out there from young people who are uninformed about what Mpox is. So can you give us like a brief intro to what it is and how people should stay away and how it can be contracted as well?
Well, like you said, Mpox is basically a disease of animals.
Yeah.
That's why they call them zoonotic diseases.
Okay.
Animals that find their way into human beings.
Okay.
So Mpox can be spread from animals to human beings.
Okay.
And once a human being is also infected, it can be passed from human being to human beings.
Okay.
And basically, how does it present? It presents a typical fever, body aches, but more important, enlarged lymph nodes.
Okay.
And now that characteristic rash starting from the face, scalp, over the body to the soles of the feet.
Mm-hmm.
Is that rash once becomes pustular, that it starts creating fluid and pus.
Yeah.
That rash is very, very infectious, very contagious.
Okay.
That's when people have to stay away from people who have that.
Okay.
And that's why again now that majorly it's contracted by contact.
Okay.
Contact of infected animals to humans, infected humans to humans.
Okay.
Or if you eat the infected animal is not properly cooked, like for instance now, some of those occupational factors are famine, hunters,
yeah,
and who actually kill all these bushmeats for sale.
Yeah.
If people buy them and they don't cook them well, they can still contract Mpox.
Okay.
Now, there are areas again that deforestation where we try to clear forest for proper development. It's like you're disrupting an ecosystem of these animals. By the way, the animals involved are either squirrels, monkeys, or rodents.
Okay.
Those are the animals that they feel are the major carriers or reservoirs of this infection.
Okay.
And once you start clearing forests in some areas where these people hide, you are releasing them into other environment. That's where they start moving into the society.
Yeah.
And those are some of the things again. These are agricultural practice, environmental practice that actually lead to increased cases here.
Yes.
And again, if you have a situation where you have a huge population of people like IDPs, for instance,
yeah,
and where many people are that, once you have an infected person, the chances that the infection is likely to increase.
Yeah,
now,
to go around.
For Mpox again, sexual transmission again has been implicated. So especially again, not now, but 2022, that's just the last 2022, where the largest outbreak in Nigeria, where many people contracted diseases and a few died.
Okay.
But one or two studies have shown that it's sexual transmission for these cases. But the cases that we see in Central Africa, Kenya, all those areas, they have different strains.
Okay.
And those strains again now they affect children. So sexual transmission again has also been implicated apart from the normal contact and what have you.
Yeah.
Luckily in Nigeria here, for now, from the beginning of this year up till now, we're seeing fewer cases than in other countries.
Okay.
But again, I must warn, in the last 2 weeks, number of cases have increased. There's still fewer. Right now, we've seen a total of 55 cases confirmed.
Okay.
Out of about 870 cases that have been suspected about that were tested. Luckily, none has died so far.
Okay.
And also we are lucky. But again, the fear is that again, the strain we are seeing here is the clade 2B type, which is milder. But again, because we have cases in those borders, southeast, that were close to the Cameroonian border,
Yeah.
we have clades 1 and 2 have been seen. The chances are that you can have transfer of clades 1 into this country, and that's what we're trying to prevent
from happening. Yeah.
And prevent from happening again, we are tracing all these cases. We are working with our state governments, local governments. We're also working with port health people in those areas, those borders, and linking them together. We're increasing their diagnostic capabilities.
Okay.
Most of these laboratories, we're increasing the number of labs that can make diagnosis of Mpox.
Okay.
And we're increasing the number of labs that can actually sequence genomically into different strains.
Okay.
Not all laboratories can do that. So we're increasing those capabilities by either training, supporting the state's personnel, providing them reagents and consumables for them to be able to diagnose. We're involving the clinicians again with case definitions and case manual, how to treat these patients. And more importantly, which is what we are doing, public awareness.
Yeah.
People must know what Mpox is.
Yeah.
How it's contacted, what they must do to stop the spread. Everybody must be involved in stopping the spread by doing the right thing.
Yeah. Very important. Thank you so much for that very important bit of information, because some people have just, they've known about Mpox from word of mouth, but they've not had any control measure to know how to stay clear from the disease. And last week we got information that Nigeria became the first African nation to receive Mpox vaccines from the international community. So we're wondering if so far any of these vaccines have helped the already infected people, or if the vaccines are for people who are yet to be infected to prevent infection.
Well, both vaccines generally are given before the infection happens, to prepare people for getting the infection. That's 1. 2. Luckily, again, like you said, we don't have many cases here. So I think what NPCD, Nigerian Primary Healthcare Development Agency, is going to do, along with us, is that they're going to prioritize who to give these vaccines to. There are some people call high risk profile. Those are, you can't just give to everybody, but you don't even have enough anyway. You can't give to anybody, so you have to prioritize who to give it to. Most times you give to people who are immunocompromised, because they have very low immunity.
Yes.
So they cannot even fight the disease themselves, they have to fight the disease. That's 1. 2, people who might have a tendency to contact or contract this disease, especially where they are found. So they prioritize that, and they work now. How do you look at states where you have many cases, and that's where they distribute. So 20,000 or 10,000, I can't remember the doses again. So priority has been given to those people again they feel will need that, including again maybe some healthcare workers.
Thank you so much. And just this morning we saw news speaking about the re-emergence, or what I call another outbreak of cholera in Jigawa State. And news was speaking about it being triggered by a recent rainfall in that region, and that has led to contamination of water resources and beginning to affect people in that area. And the cholera outbreak, Nigerians thought they were done with it, is in the past, but now there's a re-emergence. How have you been handling that as well?
Cholera occurs throughout the year. It's when the cases become many or outstrip what we have, that we have more cases again. So we see cholera cases throughout the year in different facilities. The idea is that they are treated, they are well, and that kind of thing. But like you rightly said again, this year we started seeing a spike again around June. And again also coincided with the rainy season. And again, cholera again, to me, is a function of 3 things: access to water, clean water, sanitation issue, and hygiene. These are basic things: personal hygiene, environmental hygiene. If you can address those by doing the right thing, how is cholera prevented? We must know how it's spread. Our food or water is contaminated by the organisms that are causing this cholera. How is it going to be? So when you drink contaminated water, or you eat contaminated food, that's what. How does it present? It's profuse watery diarrhea, and frequently. And what kills in cholera is the dehydration, the loss of body fluids.
Yeah.
Once you see a patient that has cholera or started stooling, let's say she go to the health facility.
Yeah.
They need to replace the fluid. Once they replace the fluid, chances of death are reduced.
Okay.
But more importantly, again, we mentioned the rainy season. We have rainy season where you have poor drainage systems, where you have open defecation, where you have clean water. You have contaminated water sources.
Yeah.
And that's why this is critical, because that cholera organisms has a habit, can stay in the environment in the soil for a long period
For
of
a long
time.
time.
And that's why, again, people must do the right thing.
Yeah.
Don't be sure of your source of water, how safe it is. If you are not sure, boil the water before drinking.
Okay.
Wash your food and cook your food properly while cooking, so that the germs can be killed. Once you finish eating or stop eating, cover the food. The issue of personal hygiene.
Yeah.
Wash your hands regularly. Hand washing.
Exactly. Yeah.
Hand washing been found to reduce incidence of this by almost 40%. Any time of it. Wash your hands frequently, either after using the bathroom and that kind of your.
Yeah. Yeah.
Those are personal hygiene. Don't defecate in the open. Those are cases, again, they're not medically related, but again, there are factors that give rise to increase in cholera.
Exactly.
And again, rainy season, you must be prepared because you have runoff. And this is what I have flooding that actually can lead to contamination of the water sources.
Yeah. All right, thank you so much, sir, for touching on that. I know I stirred you off the Mpox situation with that, but thank you for indulging me. All right, so before I let you leave, just one more question. Can you please just, enlighten us about some diseases that are prone to rise? This is ember period, and some other things may come up before the end of the year. So what are the likely kind of diseases that may rise, and how could people prevent that from happening to them?
Like I said again, cholera will continue over the years. So if people adopt the right, like we said again.
Yeah.
Lassa fever has gone down, was likely to come again. And coming again now, starting from about December to next year. Meningitis too is likely to come, especially around that period.
Okay.
Yellow fever, because of the rains and because it's carried by mosquitoes. When you have rain, you have collection of pools, small water here and there, where the mosquitoes breed and that kind of thing can create yellow fever. So those are the things, again, people need to do. Diphtheria, we're still having diphtheria cases, especially with respiratory, respiratory droplets and that kind of thing. So these are things, again, personal hygiene, infection prevention and control, hand washing, proper respiratory problems. When you want to sneeze, cough, cover your mouth. And for health workers, they need to protect themselves. Wear the proper PPE, face masks, hand gloves in treating various patients, and wash dishes.
All right. Thank you so much, Dr. Jide Idris, the Director General of National Center of Disease Control. Thank you for indulging us young people. We love to hear from you, because I stay telling these people, wash your hands, eat good food, and I went to bring an elder person to come and tell them for me as well. Yes, young elderly person. Thank you so much, Dr. Jide. Thank you for having us.